Remember when you believed in miracles? It was a time when anything was possible. A miracle for some is the hope of having good health care. A vision for that miracle started almost 40 years ago. A group of volunteers helped make a vision become reality. To provide quality health care to people who might otherwise fall through the cracks. OneWorld is known as a leader in primary health care, focusing on the underserved. This focus positioned them as an ideal choice in expanding healthcare services to counties beyond their South Omaha location.
Government came to OneWorld and asked us to come down to Cass County. They indicated that there were some disparities, so we were very interested in coming down here and being able to fill some gaps. So we're happy to be here, and we look forward to being able to provide high quality care to the patients that come in.
We see a lot of uncontrolled chronic illnesses such as diabetes, high blood pressure. A lot of times they have physical illnesses as well as mental illnesses. Cass County is more rural than those other areas, and there's a lot of small business owners down here and a large number of individuals who are uninsured. We also have quite a few migrant workers that come here. So with that respect, I definitely think that Cass County is unique. I had a person who had multiple health problems and required medication, very specific medication that is very difficult to obtain without insurance because of the cost of it. This patient really was at her wit's end, came in here just not knowing what to do, and we were able to deal with her physical conditions and get the medication for her, but also set her up with our behavioral health services so that she can get a plan and actually start putting together the pieces of her life that she felt had fallen apart.
One of the areas that we're seeing a lot here at Cass Family Medicine is a lot of depression, a lot of the bipolar disorders. There are a lot of stressors that families are confronting, financial stressors, parenting stressors. A lot of children are attending our clinic for behavioral health services with ADHD problems and things from school. When a doctor determines that a client needs behavioral health services, they call us into the examination room, and we're able to provide services there within the clinic, within the same visit.
I've had another patient who is so enjoyable to visit with when he comes in, has multiple health problems, and he was a truck driver, hardworking, wasn't really taking care of himself because taking care of himself and going to the doctor meant taking time off of work, which then caused his illness to get out of control. And because of how out of control his illness became, he lost the feeling in his feet and was no longer able to drive a truck and lost his insurance and is disabled. That's pretty typical of the types of people that we see.
Started coming down here because it's only 2 blocks away from where I live, and the people down here are just great. They've been helping me with my diabetes and getting it under control. And one day I came in, my left leg, the calf was swollen up, and over Labor Day weekend they amputated my little toe, and it's helped out greatly since I've lost it. I've got my blood sugars back down, and they've just been wonderful people to work with.
If he wouldn't have been coming to us and getting the care that he desperately needed, this infection, he could have eventually lost his life. We were lucky to only have to remove a small portion of his toe. And
they treated me like a person instead of an injury. I think it's really important for him to be down here because they actually give something to people like me who lost their insurance. And this town's, it's one of these little communities that don't like change much, but this is a change for the good.
Along with the behavioral health services that we're able to offer, we also offer prenatal services. And there's no other offices in this county that are offering prenatal services.
I live right here in Plattsmouth, and so I wanted to find a local doctor, and this facility was the closest to my apartment. I would have had to find a doctor either in Bellevue or right there in Omaha. I am without a car, and that would have been a lot more difficult for me. I've always been scared of going to the doctor. I was really sick when I came here. They saw me within 20 minutes, and it was scary for me, but the nurses were so calm and they were really nice to me. They explain what they're doing and why they're going to do it, and it's kind of hard to find people that do that. And they have a good attitude whenever you come into the office, so that's always nice. I would definitely choose Cass Family Medicine as an option for bringing my child here after we have it.
We have a contract with a local pharmacy. It's a government subsidized prescription program where we can offer patients prescriptions at a much reduced price than what they're going to get at any other pharmacy. And that is specific to our clients. Everyone who works in healthcare makes a difference in some way, and working with this community just fills a need that I had to really make a difference in the lives of people that really need it.
The miracle of good healthcare happens through the wonderful partnerships with individuals and organizations in our community. With your continued generosity and support, together we'll be able to keep the miracle alive, making healthcare accessible and affordable to the people of Cass and Sarpy counties.